Good day, ma'am. I am Stephanie Lee, your student nurse from JH Cirilia State College, Pagadian. I will be performing an eyes and ears assessment for today. So first and foremost, gather all the equipment needed. So what we are going to need are clean gloves, pen light, and opaque cards. So I have washed my hands before coming to my patient, and I already gathered my equipment and it's already cleaned. I have observed appropriate infection control, and then the room is well lighted for this assessment, and the client's privacy is already well attended. So hello, my name is Stephanie Lee. I'm a student nurse from JH Cirilia State College, Pagadian, and I will be assessing you for today. So before we get started, are there any vision or hearing impairments that may hinder the assessment today?
None.
Can you state for me your name, birth date, and address, please?
Maidan Joy A. Navarra, January 5, 2001, and I'm from San Jose District, Pagadian City.
Okay, thank you. So what we're going to do today is I will be assessing your eyes and ears. Is that okay with you?
Yes.
Okay, the purpose of the eye and vision examination is to identify any changes in your vision or signs of eye disorders to initiate early treatment or corrective procedures. As for the ears and hearing examination, it is to evaluate the condition of your external ear, your hearing acuity, and equilibrium. So everything that will be done here will be confidential, so you don't have to worry about it. Only me and the rest of the healthcare team for attending your proper care will be the one to know your assessment. So what you're going to do, ma'am, is just sit properly and comfortably. So we will start by me asking you questions. Do you usually wear contact lenses or reading glasses?
No.
Okay. Does your family have a history of diabetes, hypertension, or eye disorders?
No.
When was the last time that a professional checked your eyes?
None.
Have you had any problems with your eyes like glaucoma or any other issues?
No.
So it is essential to check for, especially in older clients, the glaucoma test because you want to detect it early. So I will begin the physical assessment now. So we will start with the external structures of your eye. Inspect the eyelids and eyelashes. Okay, so we have to note its width and position of palpebral fissures. So from what I can see, the upper lid is in between the upper margin of the iris and the pupil. As for the lower lid margin, it rests on the lower border of the iris. No white sclera is seen, and above or below the iris. Lastly, the palpebral fissures is horizontal. So ma'am, can you please close your eyes? Okay, and then you can open. Okay, so the upper and lower lids close quickly and meet when closed. Next, note the position of the eyelids in comparison with the eyeballs. So, the lower eyelid is upright with no inward or outward turning. Eyelashes are evenly distributed and curve outward along the lid margins. Observe the position and alignment of the eyeball in the eye socket. Okay. The client's eyeballs are symmetrically aligned in sockets without protruding or sinking. Next, ma'am, please keep your head still and follow my fingers with your eyes only. So while doing this, we have to observe the clarity, texture, and color. So the bulbar conjunctiva is clear, moist, and smooth. The underlying structures are visible. The sclera is white. Please look up. Okay. The lower and upper palpebral conjunctivae are clear and free of swelling or lesions. As for the palpebral conjunctiva, it is also free of swelling, foreign bodies, or trauma. Inspect the lacrimal apparatus. Okay, there is no swelling or redness over the areas of the lacrimal gland. The puncta are visible without swelling or redness and are turned slightly toward the eye. Next, palpate the lacrimal apparatus. There is no drainage from the puncta when palpating the nasolacrimal duct. Next, inspect the cornea and lens. Okay. The cornea is transparent with no opacities. The oblique view shows a smooth and overall moist surface. The lens is free of opacities. Let's inspect the iris and pupil. The iris is round, flat, and evenly colored. The pupil is round with a regular border and is centered in the iris. The client's pupils are equally in size, about 4 to 5 millimeters. Next, test pupillary reaction to light. So, ma'am, please focus your eyes on a distant object. Okay. Okay. The direct pupillary response of the client is constriction. Next, so ma'am, please focus your eyes in this pen light, and then behind my back, and then in this pen light, and then behind my back. Okay. The pupillary response is constriction of the pupil's eyes and convergence when focusing on a near object. So we will go to extraocular muscle test. Okay, so ma'am, look straight in my eyes. The reflection of light on the corneas is the same spot on each eye, indicating parallel alignment. So ma'am, stare straight ahead and look at a distant object. Cover your eyes with this. Okay, so stay still. Okay, and then your right eye. Stay still. Okay, the uncovered eye remained fixed straight ahead, and also the covered eye remained fixed straight ahead after being uncovered. Ma'am, please keep your head straight and focus your eyes in this pen light and follow it with your eyes only. Okay. Eye movement is smooth and symmetric throughout all 6 directions. So now, we will evaluate the vision. First, assess peripheral visual fields to determine the retina and visual neuronal pathways function to the brain, and second, or optic cranial nerve. Cover your left eye with this card and look straight at my nose. Okay? Say okay if you saw my pen light coming into your peripheral vision.
Okay.
Start.
Okay. Okay. Okay.
Look directly at my nose.
Okay.
Okay. And next, in your right eye.
Okay. 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 Okay.
The client has a normal peripheral vision. So next, we will assess your ears. I will start by asking you questions about your ears. Does your family have a history of hearing problems or loss of hearing?
Yes, my younger brother, he can properly hear in his right ear.
Right ear.
That's it.
Are you experiencing some pain in your ears?
No?
How about ringing, roaring, or crackling in your ears?
No.
You spend a lot of time swimming?
No.
I will begin my physical assessment. We have to note its symmetry of size, shape, and position. The ears are equal in size bilaterally. The auricle aligns with the corner of each eye. Ear lobes may be free and attached. Next, continue to observe for lesions, discolorations, and discharge. Okay. The skin is smooth with no lesions, lumps, or nodules. The color is consistent with the facial color. No discharge is present. Next, palpate the auricles and mastoid process for texture, elasticity, and areas of tenderness. The auricle, tragus, and mastoid process are not tender. Next, we will assess the general observation of hearing and equilibrium tests. This test is an efficient screening test for detecting hearing loss. This will test if the patients respond correctly, hearing is considered normal, and no further screening is necessary on that ear. Okay, so put your fingers right here and rub it in a circular motion. Now tell me which ear is the better one and the poorer one.
My left ear is the better one, and then my right ear is the poorer one.
Yes. Now you can stop that. Now I will whisper something to you and please repeat it back to me.
Friday.
Okay.
Friday.
Okay. The client was able to repeat the two-syllable word I whispered correctly. Now lastly, perform the Romberg test. Ma'am, please stand with your feet together and then your arms at your sides with your eyes closed. Okay. Okay, you can now sit. The client was able to maintain a position for 20 seconds with a minimal sway. Document all your findings in the client's record or electronic forms or checklist supplemented by narrative notes if appropriate. Now that would be all. Thank you and God bless.